Hello, my name is Joseph Laurio, and for my signature assignment, I did testicular cancer. Now, what testicular cancer is it's basically overall a disease that develops in one or both of the testicles. And in this presentation, I'm going to go over both the etiology, the demographic, anatomy, physiology, and symptoms, and the diagnosis and treatment. The etiology of testicular cancer forms when malignant cells develop in the tissue of testicles. It's pretty rare, and it only develops in men or males, and it is possible to develop the cancer in both testicles at the time. And there are four stages to testicular cancer, actually. So there's a stage zero where abnormal cells have developed, but they are just confined to a testicle. And then there's stage one, where the cancer is diagnosed, but still confined to the testicle. But however, this is where nearby blood or lymph vessels can be affected, and then tumors may or may not have been developed. So this is like one of the earlier signs of it, and it's not fatal yet, but it can start forming or affecting nearby areas of the testicle. Then there's stage two, where cancer is confirmed to have spread to the lymph nodes, and this affects the back overall, which is the retroperitoneum. And then we have stage three, where cancer is confirmed to have spread to lymph nodes. And then that means that because they are affected the lymph nodes, it has gone beyond the abdomen onto other organs, which can become really fatal. While there is not a specific gene linked to testicular cancer, the probability of inheriting the disease is still considered high. So it can be passed on from male to male generations. It is possible to pass from generation to generation, just like I said, but it could also have behavioral factors that could contribute, including smoking, alcohol, marijuana, and drugs. And there's also environmental factors that could contribute as well, like pesticides and then heavy metals. And then I wasn't really sure what they meant by heavy metals, but like elements such as cadmium can also affect the probability of developing it. Now, the demographics is, of course, it's only found in those with testicles, and the chances of developing testes cancer is 1 in 270. So the factors or the chances of development is pretty low, but like I said, other factors may increase the chances of it. It's most common in men in their late 20s and 30s, with the most common diagnosed age being 33 years old. Um, Fatalities from the disease it's pretty rare. So it's only about an average about 400 per year. In both the United States and the entire world, it is found the most common in the Caucasian race. And Europe and the US having the highest diagnosis of testes cancer, as seen in these stats here. Now, the anatomy of it is the testicular cancer first develops in one or both of the testicles. The tumor developed can go on to affect the lymph nodes, like I said, and then from there, it affects the blood vessels that are nearby in that area. So, since it starts in that lymph node goes on to different organs, which could be affected because of that testicular cancer that developed in that area. Like I said, the first thing that's going to get affected is the retroperitoneum, which could be is the first organ, and then the disease can then spread onto the liver. The next would be the lungs, and then the brain would be affected last. And this is all traveled throughout the lymph node. The physiology and the symptoms. So, unlike the normal anatomy of a healthy testicle, there is a bump is grown on the organ, which is the tumor itself, kind of similar to like how it is in breast cancer, where you might feel a little bit of a bump on the breast. It's gonna be the same on that testicle. It is caused by the malignant cells developing in the testicle. Symptoms at this stage include a lump on the testicle and heaviness in the abdomen area. Since the lymph nodes begin to enlarge, because these are the first things that are affected, it enlarges and becomes abnormal, which goes on to affect the rest of the body. Once affecting the lymph nodes, the retroperitoneum develops symptoms of lower back pain. And then once it travels down to or travels up to the liver, it can cause belly pain. Then going up to the lungs, it could cause effect of shortness or breath. And then becoming really fatal when it affects the brain the last, it causes headaches and confusion. But since testicular cancer is pretty easy to catch, it's there's still a good relative 94.9% survival rate. So for the diagnosis, you could either do a physical examination of questioning of physical or questioning of history and symptoms like in the family lineage or inheritance. And then there's an actual physical inspection for lumps or enlarged lymph nodes itself by the biomedical professional. You could also diagnose it through an ultrasound or ultrasound, sorry, which is shadows on the ultrasound indicated if the cancer is present. Blood flow also indicates sign of cancer if the blood flow is high in that targeted area as well. Now, it is a completely curable um, disease. You could either do radiation therapy, which is at stage 2, which the machine is placed over the affected area, and this machine emits high-powered X-rays to stop growth and kill cancer cells. You can undergo chemotherapy, and you could do this in either stage 1, 2, or 3. That's when the drug treatment that is injected directly into the vein. The drug transverses through the body to the cancer cells and kills the ones that are not attached to the tumor. Or you could do surgical, which is stage 1 or stage 2. And this actually surgically removes our affected lymph nodes in the abdominal region, but it couldn't affect ejaculation. Now, this is all done or recommended on which one you should do by a medical professional. I'd probably say the best way to do it is either do the surgical or radiation therapy, just because this actually kills the cancer cells itself versus the chemotherapy is kind of chasing it throughout the body. And we are able actually to use AI now, the IgCCCG related metastatic germ cell testicular cancer prognostic based staging system, a little bit of a tongue twister. This AI was actually used to study, analyze, and interpret the stages of testicular cancer. By giving AI ML algorithms to develop predictive models, the combination of our patient's characteristics variables that AI was able to detect the stage of multiple cancers diagnosed with testicular cancer. Like how I've done with most of my other weekly discussions, I think AI is really good in plugging into a database and going over different kind of patients' files and being able to develop, okay, well, because this, and this happened, there's a good chance that this, and this will happen. So it's kind of similar to how this one works for testicular cancer. If you could go over like the inheritance rate, go over the genetics that were before, and like take into consideration the factors of environmental and behavioral, it will like develop like a statistic of showing up, okay, what are the chances of what stage you're on? And this is done by inputting data tests of the patients from ultrasound, blood tests, and urine samples. I think this can be really helpful to give the stages of testicular cancer and help professionals choose the best for their treatment. That's all. Thank you.